Hey guys, welcome back to the Holistic Rehab Room. Today we are going over the Unhappy Triad. What structures are injured? We have the medial collateral ligament or the MCL. We have the anterior cruciate ligament or the ACL, which most people know. And then we have the medial meniscus damage. The medial collateral ligament. The MCL resists forces from the outer side of the knee. It prevents gapping on the medial aspect of the knee joint, and it acts as a stabilizer. The origin is the medial border of the femur, and it inserts on the medial border of the tibia. The etiology of the MCL. So, MCL injuries often occur in sports injuries, and 60% of skiing knee injuries involve the MCL. The mechanism of injury is abrupt turning, cutting, or twisting, and then also a blow to the lateral aspect of the knee under extreme valgus stress. Clinical features. So these are usually graded on 3 grades. So grade 1, we have pain along the MCL, but little to no joint opening, so that's considered an avulsion. You have a grade 2, which is some opening of the joint space, but with a firm end point up to 5 millimeters, so that's a partial tear. And then we have a grade 3, which is significant joint opening, no end point, so there's an excess of 10 millimeters, and that's a complete tear. Okay, now we're going to move on to the anterior cruciate ligament. The ACL is a strong ligament of the knee that helps the tibia stay situated directly under the femur. It resists shear forces, posterior displacement of the tibia on the femur. It lies entirely within the capsule of the knee joint, but is extrasynovial. The superior attachment is the facet of the superior aspect of the medial surface of the lateral epicondyle, and the inferior attachment is to a facet on the medial part of the anterior intracondylar area of the tibial plateau. The mechanism of injury. It is usually as a result of an acute non-contact deceleration injury. It can be caused by forceful hyperextension, or it can be caused by excessive rotational forces. Ligament injury grades. So you have grade 1 through 3. Grade 1 is avulsion, grade 2 is a partial tear, and grade 3 is completely torn. Complete disruption to the ACL typically results in dynamic knee instability or inability to respond to quick changes in position. The medial meniscus. The medial meniscus is a crescentic fibrocartilaginous structure situated within the capsule of the knee joint. It is responsible for shock absorption through the knee joint. The etiology. So this is usually in young individuals 15 to 45 years of age, skiers, athletes such as football and handball, and martial artists. Etiology and mechanism of injury. Sports-related injuries are the most common cause. Underlying mechanisms may include cutting, twisting movements, hyperextension, or actions of great force that can occur from vehicle accidents. Legs in knocked knee position, which is a valgus. The knee rotates outward while the lower leg remains immobile, so that gives a valgus stress. One of the tears, which is most important would be the vertical longitudinal, which is a bucket handle. And the other types of tears you have are flat, oblique, radial, transverse, and horizontal complex. Signs and symptoms. So the signs and symptoms are pain, swelling, locking, joint effusion, joint line tenderness. You can have a loud pop that would be heard. There's knee swelling. So the knee swells up excessively and becomes extremely painful. You cannot bend or straighten the leg because of pain and swelling. Twisting of the leg when the person attempts to stand or walk. And this is twisting under strain, which is known as the giving way phenomenon. You have bruising, which occurs days after the injury, and you have limited range of motion due to stiffness of the knee joint. Complications. The complications are osteoarthritis, meniscal degeneration, patellar fracture, patellar tendon rupture, reflex sympathetic dystrophy, and post-op you can have graft failure or graft impingement. Management, so you have ice, ultrasound, TENS unit, inferential, and for exercises you have VMO strengthening, which is vastus medialis oblique strengthening, and we have balance exercises, and you want to strengthen the abductors and adductors, and you want to incorporate hopping and jumping. Thank you guys so much for tuning in again, and I hope you enjoyed this. If you have any additional information that you want to add, you can add that in the comment section. Please like, share, and subscribe. Hope to see you guys next time. Thanks for watching.